Welcome everyone, good morning. Thank you for joining us. My name's Hannah Sampson. I'm a senior consultant with Mutual Ventures. We are a consultancy that work with public services. If you are here today to hear about the effective pre-proceedings and find out more about what good looks like, then you are in the right place, so welcome. Before we kick off, I would just like to welcome Sarah, who's joined us this morning. I'll hand over to Sarah to introduce herself and then we can get going. Sarah?
Thanks, Hannah. Yeah, so my name's Sarah Henry and I'm a PLO service manager currently in Warrington Borough Council in the Northwest. And I have been the project lead on a couple of projects that specifically look at pre-proceedings and care proceedings over the last 2 years. And I'll talk to you a little bit more about that after Hannah's finished her part of her presentation. So good morning, everyone, and thank you for joining us.
Thank you, Sarah. So as many of you know, this is the first event in our series of learning events. These learning events follow on from, I imagine, a project that many of you here today have been a part of, which is us looking at the financial impact of care proceeding delays on children's services. So today's session is focused on effective pre-proceedings. We then have 3 more sessions over the next month, looking at data, workforce, and culture. We'll share the slides after the webinar along with the recording, so you can access the registration links, but hopefully a lot of you have the links in your inbox already. Any issues getting into those links or signing up, please do reach out and let us know. So the plan for this morning, I will spend about 10 minutes or so just running you through the key insights following the piece of work that we've been doing around pre-proceedings. I'm spending some time talking about examples of good practice. And we heard throughout the project that there was a lack of operational intelligence and understanding of what good looks like compared to when you're looking at what each other do in terms of local authorities. So this is an opportunity to explore different ideas and different approaches to pre-proceedings. I will then hand over to Sarah, who will talk about how they have, in the Northwest, they've looked to strengthen pre-proceedings practice, and then she'll tell us a bit more about the project that she's leading at the moment, which is looking to develop a national pre-proceeding data set, which I suspect a lot of you here today have also been involved in. And then finally, we'll have a 15-minute slot for some Q&A. Hopefully you can all see the Q&A function as part of this webinar. Please do drop in your questions as they come, and we will then come to those at the end. If I could work out where the next button is, it's very smooth from me. There we go. So project overview. So just a reminder of why we're here and where all this information that we're about to tell you about has come from. So the objectives of the piece of work that we have been doing over the past now 8 months has been to develop and roll out a financial modelling tool that allows local authorities to understand and quantify the financial impact of care proceeding delays. And as part of that, we've also been engaging widely across the care and judicial system. And we've been developing some realistic cross-system responses and understanding the key issues linked to the identified delays. So that's where a lot of this information today has come from, through that second part where we've been engaging with local authorities, CAFCAS, the judiciary, also the Department for Education and the MOJ as part of the steering group as well. So in terms of how many people we've engaged with throughout the project, you can see a large proportion of local authorities. So we've engaged with 104 local authorities, 6 designated family judges, 4 CAFCAS managers. We've also run a number of system level deep dives where we've engaged across the system, bringing together stakeholders, and we've also run sessions with young people and families as well. And I think this is a good opportunity really for me to just say thank you to everyone who's here today that has been a part of that. We appreciate that everyone has very busy day jobs and competing priorities, so we're very grateful for the time spent engaging with us, and the amount of engagement we've had across the sector has been really great. And then in terms of the activity of the project, as I say, we've been rolling out the financial impact modelling tool. We've also developed a benchmarking tool, which I know some of you probably will have been engaged with. We've run diagnostic questionnaires, and we've also, as I say, run some system level deep dives. So through that activity is where a lot of the information today, or all the information today has come from. So as I say, thank you again to everyone who has contributed to that so far. So taking us on to the data insights on pre-proceedings, the key highlight and key finding is that there is a huge difference when it comes to the statistics reported by local authorities. So I will bring up the first bit of intel here, and you can see the key variation really when it comes to practice, quality and approach. So when we're looking at the average duration of pre-proceedings, that varies from 9 weeks to 40 weeks. Looking at the percentage of cases diverted from court, ranging from 15% to 89%. And then again, looking at the percentage of short notice or emergency cases, ranging from 6% to 78%. So I think the key thing here is to reference that this is a relatively small sample size, but what it does show is the variation and also the inconsistency in approach, which also, as we've heard from everyone really we've engaged with, the impact that does have on outcomes when it comes to pre-proceedings practice. Another key thing we found was that actually there's a key data gap, which I'm sure Sarah will talk about a bit in a moment. We found that 36% of local authorities that we spoke to couldn't provide any level of pre-proceedings data when we spoke to them. So this really showed that the varied approach when it comes to data collection, while some aren't necessarily collating that data, there's also a difference when it comes to thresholds and also accepted level of risk as well, which I think also impacts this data. We did a little bit of analysis looking at the data of the average duration of pre-proceedings and the impact that has on the percentage of diverted cases. And what we can see here is a slight correlation between the two data sets. I think worth caveating that this probably needs to be done on a larger sample size to really dig into this and understand the detail. But I think interesting to see that the longer the duration of the proceedings, the more cases that were diverted away from court, which I think probably is an interesting point when we think about that 16-week timeline, and perhaps something that can look to be analysed and explored a bit further when there is a better data set, which I know Sarah is working on. So whilst there's a lot of variation, as we've just seen with those statistics, there was some areas of common practice that we found when it came to pre-proceedings. So the first is 89% of those that we spoke to routinely use a tracker to track cases in pre-proceedings. The thing that we found here was whilst lots of people had a tracker, the use of that tracker did vary, and how embedded that was in their practices also varied. We found that 89% of people worked routinely in conjunction with partners, a real drive to that multidisciplinary approach and supporting supporting better outcomes for families through that approach. And I think in a moment we'll come on to talk about gosh, my words won't come out when you say multidisciplinary approach. You say it so many times, your tongue gets tangled. The multidisciplinary approach, we'll come on to that in a moment when it comes to good practice, and we'll talk a bit more about that. So the third thing we found was that 73% of local authorities have an IRO who actively reviews and monitors the planning and progression of cases. This really showed the kind of drive towards tracking and also reducing the timeline of pre-proceedings, which is in line with that best practice guidance that came from the public law working group. So that did come up quite a lot. 70% of local authorities are proactive at identifying and locating parents and wider relatives and those networks. But what we did hear was that there were some real obstacles to this. So whether that be families engaging during pre-proceedings was a real one, and actually getting them to contribute and be proactive was a challenge. We also found that 66% of local authorities have a practice of front-loading assessments. Now, some local authorities we spoke to recognised that they need to improve this, and they needed more of a practice in front-loading assessments to be on the front foot when you do enter those care proceedings. But those that actually do have that practice also cited some obstacles, in that whilst they were front-loading and doing those assessments during pre-proceedings, at times they were perhaps being disregarded when it then got to court, and they were having to redo those assessments anyway, which almost was a driving force against having that practice. So a little bit of work perhaps that needs to be done there, and to understand that a little more. So before we come on to talk about the good practice and the examples that we have heard about through this project, there was a recognition of that inconsistency in approach, and that there were some areas for development across the sector. And I think important to note that some of these that were referenced are within the gift of local authorities, but others actually were a bit of a call to action and some further support that could help to improve pre-proceedings practice. So the first is that improvement in multi-agency work and availability of funding. There were calls for more targeted investment in, I'm going to say the word again, multidisciplinary approach, which really helped to divert cases from court. We had some examples of actually challenges when it comes to engaging with GPs and with CAMs, for example, where some local authorities felt that actually they were plugging the gaps for GPs. So where they were having to carry out assessments and perhaps, or assessments, but also therapeutic interventions that perhaps actually should be funded by the GP or the NHS services. And also then that engagement with CAMs as well, where they were still plugging those gaps too. So some more engagement, some better long-term policy interventions, more long-term planning to help to improve that. The second one was ensuring that sufficient weight is given to pre-proceedings across local authorities. Now, this really spoke to the culture shift that people were calling for amongst some social workers, but not all, more of a drive to prioritise pre-proceedings. There was conversations around some social workers seeing pre-proceedings as actually an extension of the child protection stage, or in fact at times a punishment, and really pre-proceedings was that last chance for intervention and that opportunity to provide targeted support and help to support children and families. So there was a lot of conversation around moving that dialogue and shifting that weight towards ensuring that the pre-proceedings is focused on would help to improve practice as well. And then the third area for improvement was upskilling staff across the system. And that was upskilling staff in what pre-proceedings practice is and what it should look like. And there was a sentiment that perhaps if we were able to do that, then there would be less of a staff turnover. Now, I think that's probably quite a simplistic view, but actually the link between staff turnover and the effectiveness of pre-proceedings was cited quite a lot. And obviously, perhaps upskilling staff in pre-proceedings practice and court work could help to improve staff turnover. Worth noting that one of the events we're going to focus on the 22nd of June will talk about workforce. So perhaps join that one if you're interested in talking more about staff workload. I think the other thing around this point was that actually the capacity for social workers to prioritise pre-proceedings and the space in order for them to do that. I think there was a lot of talk around people having to focus on care proceedings and those cases that are in court, and actually pre-proceedings falling to the wayside a little bit, and being able to allow social workers to have that space and time. Appreciate that is the age-old question of how do we achieve that, but as I say, perhaps something we can look to talk about at the event on the 22nd of June. So moving on to examples of good practice and why a lot of you are probably here. What we heard really was that there was a clear drive to improve pre-proceedings practice. I think recognition that the impact that has on care proceeding delays and the impact that it can have on improving outcomes for children and families was clear. There were some creative initiatives that we really heard about, drive for more partnership working, investing in more funding at a pre-proceedings level to help support pre-proceedings practice. So this slide, I want to take you through some of those innovative ideas and initiatives. I think worth noting that this isn't a case as us saying everybody should implement these within their local authorities. We recognise that the variation, the different contexts, the different landscapes, the different demographics that local authorities have, but also the different challenges that everyone is facing will impact this, but perhaps some food for thought and some ideas of what other local authorities have implemented to help improve pre-proceedings practice. So there are 4 key examples that we heard about, and these were really the kind of creative examples that came up. So the first was implementing a multidisciplinary case decision meeting panel. So a systemic team, including social workers, mental health workers, etc., providing tracking, monitoring and system of checks and balances on each case. The second was paying the cost of legal advice for teenagers. One local authority really spent a lot of time talking to us about the importance of young people and understanding the process that they're involved in, and that this was a way of helping them to do that and providing them with that advocacy, really. The third point was PLO training offered to all social workers. That comes back to the upskilling point, giving everyone more clarity on what is expected at each step, helping to improve the process and the steps for everyone involved, whether that be social workers, lawyers, or paralegals. And number 4 was strength-based and relational letters to parents. So a lot of local authorities actually spoke to us about changing their pre-proceeding letters, making them more accessible, and also developing visual aids to help parents understand the process better. I think we heard a lot actually about how it can be hard to engage parents in this stage, and what can be done to help improve that is things like visual aids was an example that we had. Now, another example of good practice that we actually heard a lot about was tailored interventions that are really focused on practical interventions and support. And some examples of this was offering specialist hoarding services and mental health support to parents to help them clear a flat. One local authority provided 24/7 support to a family with a newborn baby to allow the family to help keep the family with the baby. Help keep the baby with the family. And then support to families is being spot purchase, meaning that actually they can be more tailored. So really focusing on the needs of the individual family and spending time during pre-proceedings to really tailor the approach and the support that's provided. And actually, one local authority, we spoke to quite a lot about this, and we wanted to give you a bit of an insight into what they did. And this was a really innovative approach, and they focused very much on creative support packages and therapeutic support during pre-proceedings. Now, this local authority actually cited that they thought that the difference in their duration of care proceedings at 31.8 weeks compared to the average duration of local authorities in their county court of 54 weeks was actually down to their approach in pre-proceedings. They felt like that pre-proceedings was really where they could make a difference, recognising that the complexities around the duration of care proceedings, there are a number of factors that need to be shifted in order to reduce those durations, but actually the gift of a local authority is to drive that pre-proceedings practice and help to reduce durations from that respect. So what they focused on really was, instead of costly psychological assessments, I'm going to just try and turn the light back on, there we go. The local authority prefers to fund therapeutic support during pre-proceedings. They focus a lot around creative support packages and really building a tailored support approach for the different families and what that individual family needs at that time. This really is the summary of the good practice that we heard about. It was that drive towards creative approaches, tackling the individual need of the family, spending time to approach it in a tailored way. And I think throughout this whole project that has shone through, that local authorities really are looking to improve their practice, strengthen the approach, understanding the impact not only that has on the duration of care proceedings, but also the outcomes of that has on the impact on outcomes for children and families as well. Now, if I can move us along, this really is just a page to let you know that the summary of the work that we've been doing and those cross-system solutions and more information about pre-proceedings practice will be available on our website. Throughout this project, we've been collating all the information into a final report, which I know many of you have heard about, we've spoken to you about, and this will really summarise the approach to pre-proceedings and give a better insight into to some more best practice approaches. Now, speaking of best practice and strengthening pre-proceedings, I'm now going to hand over to Sarah, who's going to talk to us about how she has done that in the Northwest. Thank you, Sarah.
Thank you, Hannah. And you provided some really interesting insights there. When I'm coming towards the end of my presentation, I'm just going to maybe show you a couple of slides about the national report we put together, which actually brings some similar statistics to what Hannah was talking about in terms of the average time for pre-proceedings, the percentage of short notice applications across England. You know, we're in an exciting phase at the minute trying to create this data set to put recommendations forward. So where it started was the PLO toolkit. And in terms of where this came from, it was the Building Back Better funding from the DFE following the publication of, yeah, just stay on that page, thanks, Hannah. So the president of the Family Division launched the review of the public law care and cases at the end of 2018, and this was due to the rising number of cases in family courts, and then consequently causing significant delay within care proceedings for children. And following that publication of the report, funding was put in place under Building Back Better for different projects to run across the country. And Warrington bid in conjunction with Salford to lead the PLO Toolkit project. But in terms of that public law working group report that was actually published in 2020, there was two real aims that wanted to come out of that report. The first aim was to consider whether children can be safely diverted away from public law proceedings, but also about ensuring decisions are made swiftly and fairly about children in terms of the lives that are subject to proceedings. And that's because we were seeing many cases go over 18 months, 2 years, and such a long time for children not to know what their long-term plans were going to be, and especially for older children, and being able to settle and go into longer term placements if they weren't going to return to parents. So a little bit more about the toolkit on the next slide, Hannah. Thank you. So why did we build it? So when the public law working group report was put together, the panel actually worked with Essex to do a very small pilot about bringing consistency to pre-proceedings. So what they found from their report and their research was that there was a lot of inconsistency in all local authorities, even within the same region, in terms of how pre-proceedings was run, the paperwork that was used, the intervention put in place, timescales, and felt that if it's that in such a small pilot group, nationally there'll be wide variations in terms of pre-proceedings and the way that they're run. So what Essex did, we put together a very basic toolkit about legal threshold decisions, how pre-proceedings should be, a regional plan for all LAs to use it, and just sort of started on a very small scale. So we took that project, myself and Yasmin, who was my colleague running the toolkit project last year, and we decided to make a full toolkit in PLO as much as we could, and is forever developing. And we wanted to do that to try and provide consistency and quality service to children and families in the Northwest. For example, when we're doing assessments with our families, we had a look at different templates such as parenting assessments, risk assessments, and just for parenting assessments alone, we found 36 different templates across 23 local authorities, which is huge. So not only does that confuse families if they're moving from one area to the other and the work that's being done with them, if you've got practitioners working in the Northwest that are moving from local authorities, they sort of go into that authority and start again. Oh, this is a new template. What do I need to do about this? And we wanted to move away from that and drive as much consistency as we could in the Northwest. We also wanted to encourage the effective use of pre-proceedings and just ensure that interventions and assessments are timely, so that when we do step into the court arena, if we need to do, we're not starting again, and we've got that evidence base to say, no, we're not going to do that assessment again because here it is and this is our evidence. Only issuing care proceedings if it's proportionate and necessary. A culture seemed to be created where we didn't really use Section 20 anymore. If we did use Section 20 for children to come into care voluntarily in parents' agreement, we'd get into court as soon as we could. And I think that came from some legacy cases years and years back where we were scrutinised as local authorities for the use of Section 20 and not issuing care proceedings. So you'll have seen in the relaunch of the PLO in January this year that there's a big shift turned around on that, that actually local authorities were safe to do so. And if parents have legal advice and representation, to use that part of the Children Act, the Section 20, to front load and do them assessments before coming into court. Early planning and assessments, that's what we wanted to do. So what we wanted to do was shift the focus from the court being the last chance for parents, which unfortunately became a culture too. Pre-proceedings is the last chance, but in order for pre-proceedings to be last chance, we have to front load much earlier. So when we open a children's cases, family group conferences being done at child in need, child protection, starting parenting assessments, some more of them social work expert assessments within the child protection process and not in pre-proceedings. So you'd move into pre-proceedings to be looking at the main issues that remain and doing addendums or specialist reports. What we built was a self-assessment for local authorities to complete about their practice in pre-proceedings, care proceedings and private law. So what that made them do is really look at their practice, look at their training, look at their processes to understand, are they giving the best services they can for their children and young people? And if not, come up with their own development areas to work on. And following that, we ran peer reviews across the Northwest all around PLO. So it was just specifically around pre-proceedings and care proceedings. And we just sat private law in there because that seemed to be an issue as well with rising weeks in private proceedings. And then peer reviews were amazing. We had full engagement from the region and they went really well and proved some really good insights for leaders in different local authorities about developments that are needed. We supported every local authority in the Northwest to build their own digital PLO toolkit for staff to use and also regular training. What we wanted was it's no good just having tools and forms and templates. Where's the training to show people how to use things, how to effectively do assessments, how to risk assess, and really drive the strength in the PLO practice within our practitioners. So if we move on, Hannah, I hope I'm not rumbling there, Hannah, too much. There's so much to try and get in. So what we achieved over the last year was we had all 23 local authorities in the Northwest. It's actually just grown to 24 because Cumbria is separated as of March this year. But when we was working with them last year, there was 23. They all did the self-assessments and sent them in. And we did a report on where we were as a region very early on in the project. So what our development areas were as a region and what our strengths were. What we've done now is developed a shorter self-assessment tool that local authorities can use annually just to check in where they're up to with their PLO practice. All local authorities in the Northwest now have the PLO toolkit. Some of them a bit more basic, they're still building it. Some of them have got everything you can think about on there that's to do with PLO practice. So pre-proceedings, assessments, family and friends, kinship assessments, experts, just all sorts in there to support practitioners, including like practice directions from judges and the courts and yeah, good practice. We got a training program together and supported all the champions from each local authority to have a role in training within their local authority around pre-proceedings and care proceedings. But we also linked in with CAFCAS in terms of the children's guardians and how they can provide annual training to social workers to understand the role of a guardian, but also to strengthen private proceedings practice, which ultimately initially starts with CAFCAS. So they were the experts within that field. Multi-stakeholders are obviously involved in PLO, and what we did is we worked with Research in Practice for them to put together a training program, which was for multi-stakeholders in PLO, which was judges, magistrates, social workers, paralegals, legal, private legal for parents. It was really, really good sessions that we put on earlier this year, and Research in Practice was our critical friend through the project. And what we've actually established now moving forward is a quarterly practice hub. So all champions from all the local authorities meet quarterly to talk about different things on the agenda, such as good practice, changes in procedures. So we've just seen the supervision order paper that's been published and changes that local authorities need to make. So that's discussed in that forum. And we're looking at a region, how we move forward all together with consistent practice rather than everyone going off and doing their own thing. And I think the biggest achievement from that as well is for myself and Yaz having that one-to-one connection with our designated family judge. So I meet with Judge Parker from Cheshire Merseyside regularly about things that are going on for the local authority. But equally, we can both talk about things that are emerging from court and try and deal with it very much on a frontline operational level rather than just discussing it at higher level in meetings such as LFJBs. So yeah, really pleased with the outcomes this year from that project. I just thought it was important to put some voices in from staff about whether they feel it's been useful to the practice. And as you can see, I won't read them all, but there's some comments there about having adoption information within toolkit has helped to ensure that adoption is considered at the earliest opportunity. Another one, yes, I had my first case. Wow. So probably a young social worker, newly qualified, which went into PLO and it assisted me with understanding the process, which is great. That's what we achieved to do, make sure it was all clear in one place. It's helped make my practice more effective, which is great to hear from practitioners. And yeah, so there's some more examples on there for you to have a look at, but really good feedback from staff and it's been really effective. Thank you, Hannah. So next steps. So what has this project left? I think when you're running a project, it's really important to think about what legacy will this project lead? Because if you don't think about that longer term planning and what you can create at the end of a project, it becomes an isolated piece of work and sort of gets forgotten about as time goes on. So the next steps are, as I said, we've got practice hubs now where there's a champion from every local authority in the Northwest that attends. They talk about all sorts, new emerging issues in PLO, any new processes or practice directions that's come in. They share good good practice across the region, or we've got a really good parent assessment here, have a look at this. So it's all about sharing practice and ideas together and working as a region rather than every local authority going off and working on their own. We actually built that and put a terms of reference in place with the onus on the champions working together as a region, and that's overseen by our Association of Directors of Children's Services. So yeah, really good outcome there. Peer reviews, we're not making them mandatory because many local authorities do peer reviews over the years, and sometimes they want to focus on other areas of practice, and PLO is obviously a narrow area compared to everything else we do within children's services. So they've got the paperwork and the framework and structure if they would like to do that. Toolkits will always be updated. It's not a piece of work where you can build a toolkit and just leave it. Things change, processes change, new practice directions come in. So what we do in Warrington is we do a quarterly update. So we look at it quarterly, like what's changed, what's different. And even when I built it, things that you don't even think about. So our placement with parent regulations are written on our case management system, not necessarily on a Word document. So it wasn't until like months and months later someone says, "Oh, we got an example of a good parents replacements assessment." I was like, no, we haven't actually, because I haven't thought about that. So there's always things that will crop up and you think about that you can always add and keep that toolkit up to date. So the LA champions are obviously really working towards pushing that 26 weeks being adhered to in court. And the focus for them to do that is to improve pre-proceedings in terms of the interventions that are being put in place. Interestingly, Hannah, you made that comment around the 16 weeks marker. That was obviously recommended in the Public Law Working Group report. The feeling across the country in the champion group that we've got at the minute in the project that I'm running this year is you can't do effective pre-proceedings in 16 weeks, not if you're going to do cognitive assessments, not if you need to bring an expert in. And actually, pre-proceedings being sort of marked as performance indicator that you've not met 16 weeks isn't helpful to some families. So I'll talk a little bit more about that when I talk about the next project in a minute. What we've done is made sure we've kept a link into CAFCAS and our LFJB. So the PLO lead, me in Warrington, is linked into our designated judge, Judge Parker, which we meet regularly, and the CAFCAS service managers across the Northwest come to them quarterly practice hubs as well. So we're all linked together, which has just proved to be more effective in the work that we're doing in the Northwest. So thank you, Hannah. So the digital. Okay, so as many of you will know, I won't need to tell you, Warrington, not Warrington, the whole of England, there is no data set that we currently report on in terms of not just pre-proceedings, but care proceedings. There is some data in care proceedings, such as very higher level overview. So how many weeks has things gone to, just very much higher level. It doesn't really tell individual journeys for children. So this year, following the care review, so this has come from the care review report that was published, there's a very big saying around data saves lives. And I think I agree with that, but I don't think it just saves lives. I think it gives us markers and performance indicators on where we can develop improvements with our families, but also where we can share practice with other local authorities across England on this is working well, look, this is what we're doing, and working together as a nation rather than everyone working in isolation. So in terms of this project, it's huge. It's run across the whole of England. I'm sure many of you are aware of it if you're on this today. But there's 17 champions from all the different regions, and we've also got some champions from our case management teams that are working together as a big team to kind of put the recommendations in place for this project. So what we're trying to do, so as part of that funding that was put forward, we bid and we're leading the project, and it's focused on developing that national data set. And it does say on the effectiveness of pre-proceedings, but I keep pushing back to the DfE saying this isn't just pre-proceedings, you want care proceedings data. So actually it should be a PLO data set, and we'll probably change the name of that in our recommendation at the end, but that's what we're doing. We're in the research phase. We're massively into it now. We've actually done 2 collections on different levels of data that we have to collect. I'll show you that in a minute. And all I can say that it's going amazing. We've actually had out of 100 and I'll say 152 because Cumbria wasn't split up when we were doing this. We've had 121 collections from local authorities across the nation, which is just amazing, the engagement, because I'm well aware of how much time and commitment has to be put in to get data that we're not currently capturing. So I know people will have audited files, gone to legal for stuff, and I know it's not easy to do this project at the moment. So CAFCAS and the court system were also involved in this. So I'll talk to you a bit more about that through the slides. And I'm also working with software providers across England about their obligations to support local authorities in collecting data for children in pre-proceedings and care proceedings. So currently there's no statutory obligation, so it's not within their system. So We're having a few fights, to say the least, but the DfE are supporting in them conversations to try and get some things changed whilst we're in this project this year, to be universal changes for all local authorities with no cost to local authorities. So still early days with them discussions, but we're hoping to make some changes. And then if we move on, I'll just let the PowerPoint. So what do they want us to achieve? So first of all, it's to have a national data set and a scorecard for our children on PLO. So that includes pre-proceedings and care proceedings as part of the PLO process. What we want to be able to see is not just higher level overview data that gives us numbers. We want to be able to see a journey for a child that steps into PLO and out the other end. What has this been for them? What's this process? We want to be able to measure the effectiveness of pre-proceedings. But I think that's really easy to say, but not do. So as we've talked about, 16 weeks is the in the public law working group like as best practice, but that is not effective, and that's what we're seeing more and more as we're getting data in. So what we're going to have to be able to do is establish what we think as a nation is good. What does good look like, and then basically the data set around that. I think it's great that you can see national and regional differences already in the reports that we're doing. The reports that we are doing are just research at this point. Although the data is coming from local authorities, we've been able to work out averages and rates, but they're very much research rates and averages because we've only got 121 local authorities data. We haven't got everyone, so we can't say, yes, this is the rate for England, this is the average. But what we can say is, this is what we've worked out as the research rate, and this is what we worked out as the research average. It's really, really good to be able to measure effectiveness against your statistical neighbours, see where you're at in terms of performance. We really want to improve systems to make digital data easy to run and report on. And we will need to look at supporting policy making at the end of this project. And I think what Hannah touched on that, about a lot more emphasis being put on local authorities front loading in pre-proceedings, comes at a cost. It comes at a cost for the reports we're doing. The data side of it comes at a cost for data teams. Some people haven't got systems in place that can easily maybe look at digital reporting on a sort of a national level. So the recommendations we make will be definitely to support policy making and funding that may be needed to achieve this data outcome to become a statutory return. Thank you, Hannah. These is just, if you've not seen them before, if you have, nothing's changed. These are the data points that we're collecting. So last year there was a very small pilot run with just a few regions and a few local authorities from the Building Back Better funding, and they looked at what data points will we need to try and measure what effective pre-proceedings and care proceedings could be like. So what these are split into bronze, silver and gold, and currently we've done the bronze and silver collection, which has been great, where we've had, like I say, 121 local authorities engaging. The next collection is going out on the 12th of June, and that's where we're trying to collect. And if you look at that gold, some really sophisticated pieces of data, because these aren't just numbers. Family group conferencing, yes or no, we could possibly capture that. Changes of social worker, how do you get a system to tell you how many changes of social worker have happened in a pre-proceedings period? It's really difficult. So what we found is the way that we have to do it is build it into workflow. So what we've been doing as a team is national workshops across England to show people how just the two biggest systems, Mosaic and Liquid Logic, you can build workflow to capture these data points. So you as a local authority have got your own data to look at and scrutinise, but also if you're asked to move into a regional or the national data collection when it does become statutory, you're building up to be in a position to do that. So I'm not going to go through them all, but they're there for you on the slides when we send them out. Thanks, Hannah. So what have we achieved? So we're currently, the project's due to end at the end of October, so we're pretty much halfway, we're just over halfway through. We did a national survey, which closed recently, and we had an 84% response rate on that nationally, which was amazing. That was very much looking at how people felt they would be able to collect the data, what the difficulties it would be, what things they might need to be able to do it, and what systems people had. And all that information isn't going to be wasted. Some of it's being used currently. We now know that 87% of England use Liquid Logic or Mosaic, which is a huge amount of children's services. And we also know lots of different barriers to the collecting points that we'll be looking at putting in our final recommendations when I'm talking about policy making and legislative changes potentially. In terms of the bronze data, we got a 68% return, and then that's increased. So when we got the silver in, some local authorities decided to send bronze and silver together, and we've actually had a 79% return of data across the country in terms of what we're asking for. So that's amazing. Our case management leads have put DIY packs together for Liquid Logic case management staff and Mosaic, just to show them how they can make changes to their systems so they can capture some of these data points that are needed. And we're doing that because this is not going to go away. We're going to end up having to do a statutory collection on our children in PLO, and that's looking to be something that's quite interactive. We're not looking at just sending numbers into a portal like a SIN census. Currently, our thinking is, as a champions group, this becomes a quarterly thing that we put our data into a portal, and then there is a digital report for everyone to view in children's services, rather than it just be paper with numbers and that doesn't tell us an awful lot. I think there might be some questions wanting to be fired at me that what about the courts and what about Kafka, because it's not just local authority data. I completely agree, it's not. So we're currently in discussions. We have looked at how much it will cost to build what we call application program interfaces between Kafkas and the courts. And what that would do is the local authorities will potentially extract the data from the data set that they need from court and Kafka, so they don't have to capture everything quarterly from them systems and then add it into the data set which they'll upload. So we're wanting to try and share the burden rather than it all set on the local authority. Now we've done the estimates, we're starting the data protection side, so we're going to start them discussions with sort of the executives and senior leaders in Kafkas and court about, are you willing to provide this in a data set for one? And if they are, how are we going to go about the data sharing to do that? Because the systems won't take as long to build as it will, believe you me, to get data sharing things in place across the country. So although that might not be in place at the end of this project, it's definitely something that will potentially be extended because then discussions are starting. We started work with our software providers. I wanted to get a full working group together with them all, but that's not going to work because they're very much their own people, and I understand that. So what we've done is we're meeting with them all separately about what our requirements are from them and what we need them to do. So as a quick example, on Mosaic, we currently don't have a PLO badge. So you wouldn't know a child is subject to PLO unless you looked in legal gateway minutes, pre-proceedings plans, places like that. What we want to do is have a badge like child protection and SIN, and also a history. So when you're being asked, is this a repeat period of pre-proceedings or care proceedings, there's actually a PLO history, like a child protection history, so it's really clear on the file that, oh, hang on, this is a risky case because they're also sat in PLO. So I don't know when that will come, but we're trying to get it ready for everyone's next update. And in terms of Liquid Logic, if you've got Liquid Logic as your system, you will know that you don't have a workflow for PLO at all within the work map. So Kyle, who's our case management lead for Liquid Logic, is working with them at the minute to look at how they could implement that and put workflow into place. And I've asked them to go away and cost it to see if any funding pots from this project could potentially do that in a universal change as well. I can't promise, but that's what we're trying to achieve. And we're now coming, we've done our silver collection. Like I say, amazing. We've got a 79% return. So yeah, thanks, Hannah. So next steps. So we're sort of gone into some of these steps now. I've written a very draft report, which will go to our progress hub tomorrow, and all the champions will look at that report. They'll look at the barrier report, and then we go off into little breakout rooms and we discuss the data points, we discuss the barriers, and all that information that we discuss and agree on gets collated together, and all that will contribute to what we recommend at the end, what the data set should be, which agencies should provide which part, how agencies should do it, what funding we might need, what systems we might need, and what support from the government. So that's the idea of them progress hubs. The DIY packs have already gone out. If you haven't got them and you do need them, I will drop into the chat nearer the end the pre-proceedings box. So if you need any of them, let us know and we can forward them to you. And we're beginning our conversations now with our chairs of our Association of Direct Children's Services across the whole country. So what we'd like to do is sort of copy what the Northwest have started to do. So we've started to do a data collection on PLO in terms of our some of the bronze, well, all of the bronze and some of the silver, just to get people into the habit of doing it. And we weren't doing that for a statutory collection. We were doing that as a region, so we could start to have a bit of curiosity around what's happening for us as a region, but also about knowing our performance and, okay, so what's this telling us? Why has that local authority got less children? So this other authority got a higher rate in pre-proceedings, and really helping each other as a region improve practice. So that's where we're at with that. Thank you, Hannah.
Thank you so much, Sarah.
I'm just wondering whether I should just share a snippet of the report, or Oh no, we've not got time, so we'll go to questions and answers. That's fine.
I was going to say, I think with the interest of time and give people the opportunity to ask some questions, we
Yeah,
will move on to the question and answer. I think super interesting presentation and really interesting to hear that a lot of the findings that we found through our project, you guys are actually addressing
yeah,
through this national data set. So good to know everything is aligned, and we have a seamless presentation. So as I say, I'd like to invite people to please post any questions that you have, and we will address those in the next 10 minutes or so. So to begin with, Sarah, I think a question for you.
yep.
Many people have said that the PLO toolkit sounds like a very helpful tool, as
Yeah.
I'm sure we expected. Do you have any resources you could share with attendees today?
I can do if I'll tell you what, if I put, so I don't get flooded on my mailbox. If I put the pre-proceedings mailbox in, and I'll send you what I can. I've got an example on Word of what you need to set it up like and what you need to put it into. So what I could do is send it you via WeTransfer. But if your LA won't accept that, there is another way of doing it. You might just have to give me a week or so before I can work on that, because I'm just currently writing the silver reports. But yeah, absolutely willing to share tools nationally for people to look at that.
That's great. Thank you, Sarah. In terms of contacting, we can support with that if helpful, and people can reach out to us, and we can support disseminate that, because as you say, don't want your inbox to be flooded, given you're very busy writing the report as well. In terms of the PLO toolkit, just focusing on that, how did you as a region help to support consistency when you were building that toolkit?
So what we did is the practice hubs that have now become quarterly, we met monthly, and what we did is we focused on the biggest area of lack of consistency. So what that was is what the plan actually looked like and the purpose of it and the assessment tools. So what we did as a region is agreed a format of what the pre-proceedings plan should look like, what should be in it. Every LA's is slightly different because you've got different models that people work to, like signs of safety, systemic. So, but basically, the way the plans are very, very similar. So it drives that consistency. And what we did is we had a look at how we would break some of that down. So then 36 dropped to about probably 6 across the region, which is pretty amazing, maybe 7. But what we've done is the toolkit is we've had to change a culture, Hannah. So it's not been about just giving them a tool. It's like social workers will go to managers and legal saying, can I have a template for this, that, and the other? And it's about saying, no, go off to your toolkit, it's all in there. Because what we find is when people are asking each other, you might have agency staff who've used one that's different in another local authority or even another region if they've worked in another region. And then that's where you start to spill a lack of consistency and it's not seen. So we work together with champions in the practice hub to really focus on them pieces of work. And what I did is and Jasmine did, we did our sort of toolkit. We built ours first to show them how to structure it, and then everyone sort of I won't say copy, they built their own but within a similar structure, so they're all very similar whichever local authority you move into.
Great, thank you. Someone has asked whether there are any plans to extend this to Wales or border counties. I assume this is talking about the data set rather than the PLO toolkit.
Yeah, so in terms if it is a data set, the discussions are it's currently taking place with the DfE and the Welsh Government. So they are very keen to hear about it. The judges, I was on a meeting in the public law working group with Mr. Justice Keegan, the president, and some of the designated judges, and Wales were at that meeting. I can't remember your judge. I'm really sorry. That's really rude, but I've only met him once. And we do want you to extend it there. So basically, I don't know when, but hopefully it will follow in Wales. And maybe if we get something together in England, it'll be a little bit easier for Wales to follow and look at if they want to obviously report on the same thing.
Great, thank you, Sarah. When do you think a statutory return on PLO data will come into force? Sorry, I feel like I'm just firing questions at you, and none are for me, but they're coming in and everyone's interested in what you say, Sarah.
I can't say, because obviously it's not just my decision, although it's overall our decision in Warrington. It won't be in the next 12 months because there's no way local authorities are in a position to do that. But I don't think we could push it longer than 12 months. So we need to be realistic. If we say 18 months or 2 years to the DfE, and it goes back to obviously we're working with the Ministry of Justice as well. They're like, that's way too long. We have to show some willing. So that's why I'm working with the ADCS chairs, and sector-led improvements in them groups to look at, as a region, maybe you starting to deliver some of that bronze and silver stuff into your regional rig, so you get used to that capturing and reporting. But I think 12 months gives local authorities the time then to change workflow and capture. It also gives time for us to get the data protection side done with courts and CAFCAS and build them APIs. I think I will be pushing to 18 months, but I think we'll only get 18 months if we say we're going to do something in the interim, which if we say we're going to start collecting, all regions are going to start reporting into the rig these indicators to get used to it. I think that would help us get a longer timescale at the end, if that's helpful.
Great, thank you, Sarah. Conscious of the time, are there any final questions? I know we were aiming to have a 50-minute session, because I know people are always welcome 10 minutes before their next meetings, but just a moment for any final questions. If not, we will give everyone those moments before the next meetings at 11, I'm sure. Thank you for sharing, Sarah. Sarah shared with us the email for the toolkit, so we will include that in our email that we share around with the slides and the recording as well. So we will make sure that everyone has access to that to access the toolkits and the DIY packs as well.
There was a question for you, Hannah.
Was there?
Yeah, it was about what insights did you get from the engagement with the young people and family? Because it'd just be interesting to hear their views. Is that in a report somewhere, or?
Yes, so we will, as I say, we are at the moment finalising the report over the 8 months of work and engagement, as we said, across the sector. So that is being collated now into a final report that will be uploaded onto our website. So please do keep your eyes open for that and have a look, and that will include insights from everyone that we've engaged with, and summarise those cross-system solutions and recommendations that we have gathered as part of this work. So please do have a look at that when it's published. Thank you, Sarah. You're doing a better job at scanning the Q&A
it's
than I
fine.
am.
It's fine. I'm used to doing them. It's all right. There was just a quick one there from statistics, Michelle. Yes, there is a difference in statistics. So what we're finding is, obviously, not statistics. What we're finding is everybody in the local authority's got a bit of the data. So legal have a bit of the data, the social work team have a bit of the data business support team have a bit of the data, and they're having to then merge it together, so it's not sat in one place. So hopefully this project that we're running this year will support them to have the data in one place and actually capture it digitally from case management systems, rather from having trackers and spreadsheets that you then need to filter and get your data from.
Thank you so much, Sarah. In the interest of time, I think we will draw the Q&A to a close. If there are any questions that you want to ask or haven't been answered, or things that pop up in your mind over the rest of the day, week, whatever, please do just reach out to us, and we can answer those. And as I say, we'll share the details about how everyone can access the toolkits and the DIY packs as well. So without further ado, I just want to say thank you so much, Sarah, for joining us this morning, and also for everyone that's joined the session as well. It's been great working with a lot of you who are here today throughout this project. So yes, thank you, and enjoy the rest of your days.
Thanks, everyone.